related to integration, both the current review related to nutrition and the sick child encounter, as well as the previous reviews we've done with nutrition and ICCM, I think we found there's a lot of things that are integrated. There's a lot of the nutrition aspects that are in the different guidelines. And the bigger question is how to really bring those out, what's appropriate, understanding what's already there and how it can be brought out more fully. I think especially related to the sick child encounters, also think when people were talking about nutrition isn't in there, nutrition is huge in the actual document. But if it's dropping out, why? And what's really going on? And I think this meeting hopefully will bring out a lot of the different discussions from countries about what some of those challenges are. I think a lot is also figuring out between nutrition and the child health community being able to speak the same language, being able to identify what is it that's really most important. And I think there's a challenge, especially in the nutrition, where it's very complex, and why someone is malnourished is very complex. But yet, specifically within the sick child encounter, things need to be simplified. And how can that be done in a way that doesn't lose its actual usability, that doesn't become so simplified that it's meaningless? But is there a way, and we talked today about within IMCI, within other areas like malaria, there's a very clear assessment, treatment, and prevention. It's not easy to do, but it's a very clear delineation, whereas nutrition is much more complex than that. And so is there a way for people to really innovate with thinking about what are the main messages? What are the things that are really important? I think there's a lot of potential for innovations related to the anthropometrics and the assessment, just as MUAC was a huge step forward. Is there something else that can address some of the challenges related to the younger ages? Are there some different ways of addressing that that can really be game changers in the way that MUAC and RUTF are game changers? As well in looking at, and we tried to pull out some of the complexity of all of the messages. And a lot of just on the simple side with the feeding of the sick child before and after illness, the messages are in there, but are they ever seen? And a lot of the assessment around the feeding of the child, do people ever get to that component within the guidelines? And so I think a lot of those issues, I personally think it would be fascinating to look at more of a human-centered design around the guidelines, just as people have looked at that within CHW material and looking at it in a human-centered design to how are people using this, whether there's a way of looking at the algorithms in a similar way for the health worker. Are people actually accessing this information? Is there a way things could be put in a different format, either simplified but also repackaged or put in a way that increases the potential of them actually being used? Because I think people really brought out a lot of the importance of finding these kids, but also finding them earlier. And so therefore, obviously a huge amount related to the SAM and the MAM treatment, but also related to the kids who aren't there yet, but who could potentially be identified through the assessment of feeding problems and the low weight for age. And are there ways of kind of rethinking that? And hopefully, I think there's a great group of people here with a lot of good minds around that.